Well, brother, it's been a pleasure having you in Fallaw Health and Wellness to talk about the power of our continent, Africa, what it does to us, descendant of the continent. Us, by us, I mean humans, whether black, whether white, whether Asian, whether immigrant,
right? Yes, sir.
Whether African Americans.
Yes,
but brother, what was your experience with Africa? Or, you know, your reconnection with the motherland?
I was diagnosed with diabetes. I was in a coma.
In a coma?
When it happened, yeah. I was in a coma. I had 5 surgeries. My pancreas went out. They reconstructed my pancreas, put stents in me. They took my gallbladder out. They said I had gallstones, so they took my gallbladder out and reconstructed my pancreas, and from that I became diabetic. So, and a little over a year and a half, I was taking insulin. Okay. They had me injecting myself with the insulin.
Okay.
To be honest, I never really seen or felt like I really needed the insulin.
Okay.
But, you know, them being medical doctors.
Right, the new modern medicine.
New modern medicine.
That's the new modern medicine, yes.
So I was injecting myself for over a year, maybe a year and maybe 3 or 4 months. The question was, how did I get back connected with the motherland?
That's right.
Was when I
praise be to Allah.
Praise be to Allah.
Praise be to Allah.
I was introduced to
Fallaw.
You from my nephew, right? So Michael, and you know, that was a great experience too. Our introduction and us meeting, you know, that was a beautiful thing. Alhamdulillah, right? Yes, sir. And my nephew kept telling me about the herbs and whatnot. Yeah, okay, whatever, man, you know, right. Yeah. I'm telling you, Unc, I feel like I'm 15 again. I can do things and yeah, and me being on the insulin, I'm always down and, you know, going through the changes, shaking, drinking orange juice, and, you know, I'm going through the modern day diabetes and the modern day medication. So when I did come to see you, we sat down, we talked, you know, we got our spirits right.
I didn't take your blood. I didn't take your blood sample.
No, sir.
I didn't take your weight. I didn't take your weight nor your blood sample. I didn't restrict your diet.
Sir.
Yes, sir. Yes, sir.
Yes, sir.
Because I'm not a doctor. I'm not a doctor.
Yes, sir. Yes, sir.
I'm not a doctor.
Yes, sir. I understand that, right? So, in our introduction, and we meeting one another, and you know, we got our spirits right.
That's right. That's right.
And you know, that's when the connection really come together. And I told you my problem, what I was going through after we beat the drums for a while.
And you know, Glenn, right? Not to cut you, yes, by you saying that, there is a hidden piece that I never revealed. You see how happy you are today?
Yes, sir. Yes, sir.
9 years ago, I was hoping to be happy that way.
Right. Okay.
Because when my daughter was born here, 1 pound 7 ounces.
Wow.
1 pound 7 ounces.
Right.
She spent 4 months and a half in Children's Hospital here in the state of Minnesota.
Okay.
And very fine, wonderful human beings, doctors were there, about 3 of them. These are like, I mean like top doctors of the world.
Right, right.
I asked them a very simple question. What about my baby? What would be the outcome of my baby? Is she gonna be this, she's gonna be that?
Right.
But they were honest enough with their spirit and soul to come up to me and said, there is a lot of unknown. And these are like doctors. These are like well-regarded, respected doctors. They told me there's a lot of unknown.
Right.
Oh, that, I couldn't take that as an answer. That's when I returned everything in the hands of Allah through Sheikh Ahmad Bamba in Africa.
Yes, sir.
Glenn, in Africa. Glenn, I even went all the way through court in Ramsey County to get my children, to get my daughter, because the hospital, Children's Hospital, was ready to take that baby away from me.
Right.
Not knowing that the African spirit could not be beaten down. So when we met through the drumming, I was already getting done with the whole mind and soul.
Right. Okay.
Now I needed to escalate it up to the body.
Right. Yes, sir.
And that's how you got introduced to the herbs.
That's how I got introduced to the herbs. Yes, sir.
Which are nothing but food. Because in the Quran, in the Bible, in the Torah, in the Buddhist guide or guide,
yes, sir,
they said what heals you is in their kitchen. That's what you eat, food.
Right. So beautiful. That's so beautiful. So
and how are you doing today?
So let me get after the herbs, right? I come to see you and you give me the herbs and I cleanse myself, right? Alhamdulillah.
You wash your hands, wash your internals.
Yes, sir.
Yes, sir.
So I went through the detox, you know, and
yes, sir.
Beautiful thing, beautiful. And alhamdulillah, and so I love the tea. Of course, I love the tea.
It's just African tea.
Marengo. The African tea.
It's African tea.
Yes, sir. Yes, sir. And I did the detoxing, and after I did the detoxing, I continued on with the insulin. And the insulin made me more sicker after I did the detoxing. So I realized that. I said, wow, when I take this stuff, I take it like 5:30 in the morning, 9 o'clock in the morning, I'm going through my changes, sick, sweating, and I got to give me some orange juice. Of course, I got to tell you about the orange juice. I never left home without the orange juice. It was like my credit card or my wallet. I got to take this orange juice with me because this is my lifeline.
Wow.
See?
Orange juice?
Orange juice to bring my blood sugar up.
Okay.
Right?
Okay.
And so that was my lifeline, I thought. Right? But it always helped me. I drink it.
But at least it helped.
Right.
At least it helped.
So I started drinking the tea, the African tea. I started drinking moringa with the African tea, and I did what I was supposed to do as I was instructed to do. Not because, you know, the instructions, not from no doctor, but from my friend.
Well, you know, really, in reality, it wasn't really from me because I was just an intermediate.
Right.
Back in 2016, I got the blessing of Allah subhanahu wa ta'ala to have traveled back to Africa, to West Africa.
Yes, sir.
When I went to West Africa, my thought process was two things. I'm going back to my people to tell them I want to come back home because what I'm seeing in the United States is scary.
Right.
They're like, oh no, there's nothing scary. You have very humble souls in there. However, you're missing certain things. So they really vested me into becoming a community healer. Brother,
yes, sir.
I thought as a college graduate from the University of Minnesota, having done all my research, having received a very honorable grant from the university. Actually, I was the only one from the entire University of Minnesota to have received a grant called the Fallaw International Grant.
Wow.
Back in 2002.
Yes, sir.
I take that to Senegal and Gambia to learn about the hidden reality of Africa.
Right.
So when they vest me into the whole understanding of what we in the continent have and can see to the rest of the world, that give me a lifelong job
Right. Yes,
to
sir.
talk to people about how to use
Right. Yes,
this.
sir.
And that's what I did to you.
Right. Right. And so I don't mean to cut you off.
Of course.
That's a beautiful thing, and your journey sounds beautiful, and I'm glad you took that journey.
Thank you.
Alhamdulillah. Yes, sir. And so the insulin that I was taking, I put myself through a test. So after I met with you and we discussed the herbs and, you know,
Yep.
beautiful African herbs,
Excellent.
and I used them, and it reversed the insulin.
It reversed
I said it reversed the insulin. So when
the African herb.
yes,
Reversed
Yes.
this for you.
yes, yes, and I put myself through tests because, wow, is this really what's going on? So I had to test this. So I stopped taking the insulin.
Uh-oh.
I stopped taking it for one day, and then the next day I would take it again. And I did that for like a week. But each day that I took it, I got sicker.
But I never asked you to stop taking it.
No, I asked you that.
Yeah, I told you.
I asked you that.
I told you I don't have no say about what
Right.
you take.
I asked you that, and I said, should I stop taking the insulin? And you said, that's up to you.
That's your question. That's
There
your
you go,
that's
bro.
your
Yes,
life.
sir.
I can only advise you into what I know, but what I don't know,
Right, yes, sir.
you gotta go and talk to your physician.
Ah, yes, sir. So I put myself through a test with it, and it made me sicker. So I decided, after taking it every other day, I'm gonna stop taking it for 3 days at a time. After the second day, I noticed I wasn't sick.
But were you having your orange juice though?
I still had the orange juice with
Okay,
me,
okay.
but I never ever had to touch the orange juice. I never had to touch the orange juice, right?
Is that right?
So, so the third day, I take the insulin.
Okay.
And I always take this at 5:30 in the morning. Like I said, about 9 o'clock in the morning, I start getting sick because I guess I need something to eat or some orange juice. So I did it again. And I was sick again. I needed orange juice. Now, the next following week, I don't take the insulin at all.
And what were you taking?
I was drinking my Moringa.